And in studio, it is time, Slocum Dickson Medical Moment, the first Wednesday of the month. And in studio, I have Adrian. Adrian, how are you doing today?
I'm doing great. How about you?
I am doing so good, minus the weather. It's fine.
I know I sounded really, really chipper for the way it looks out there.
It's okay. Let's talk about Slocum Dickson Medical Group, SDMG.com. Make sure you're hitting them up on Facebook and on Twitter. What do you guys have coming up lately, right now?
So, actually, we'll be out at a couple of health fairs this month, so that's something if you're out.
Fun.
Actually, right after I leave here, I'm going to Hamilton College. So if you're a
wow.
student or staff member or professor there, come by. They're having a wellness fair, and we'll be there with the table. Next week, we're at SUNY Poly, so it's a good opportunity.
Really doing the rounds.
Yeah,
then.
when spring comes, everybody starts to have their health fairs, and it's nice. We like to go, and we can talk to people in person, and you can come by, pick up information. We do some screenings, too. We'll do, bone density screening and some grip strength tests.
And all you have to do is show up to a health fair.
Yeah, all of it is free. So
that's cool.
Yeah, so it's really fun to go out in the community and meet people.
Especially in the colleges, too. There's always lots of people who need to learn more about their health, me included. And when it comes to this month, we are celebrating and making awareness about autism.
Yeah, April's Autism Awareness Month, so it's an important condition that I think people are becoming more aware of it.
I think so, too.
And at Slocum Dickson, we try to do what we can through our social media and through this, this medical segment to be able to let people know about, signs to look out for so they can catch things early and start treatment and people have better outcomes that way.
Right. Do you want to introduce who you brought here today?
Yeah. So with us today is one of our neurologists. He's been with us for quite a while, Dr. Arastu. So we're happy to have him.
How are you doing this morning?
Very good. Very good. Happy to be here.
Get right up on that microphone for me so everybody can hear you. There we go. Perfect.
Is that right?
That's perfect right there. So, a lot of people, they may see the puzzle pieces when it comes to autism to bring that awareness, but what actually is autism? Can you break it down for people who maybe don't know a lot about it?
It's a medical condition, and it is an organic condition because some people like to think that it's more a behavioral thing. It is a medical condition, and it is noticed somewhat early in life. Can be as early as 1 to 2 years of age.
Really?
Yeah.
Okay.
And most mothers who are tuned into their kids will notice that the kid is not very attentive, or rather not attentive to people, is more attentive to things around them.
Okay.
Don't make eye contact, kind of don't communicate, or may start to have language, start a few words, and then start to regress, usually around age 1 year.
So is that like the typical age at 1 to 2 years old? Is it 3, 4? How old is it when you stop seeing those kind of things pop up?
It's kind of a project in evolution. You start to see certain signs, depending on how severe it is. Those who are mild can go a little longer before being, picked up by somebody who says, geez, something's going on here.
Yeah. Right.
But most of the time, parents get worried because the child starts to speak around age 1 or say 1.5. And then he starts to lose that speech.
Yeah.
That is what kind of brings to their attention. Instead of progressing, he's regressing. And it's usually language.
Okay.
But then communication skills are also very, very, delayed or maldeveloped.
Okay.
They don't make eye contact. You give them toys. They might line them up, but they don't play with them. They don't interact with their, siblings or peers or even with their mom.
Okay.
Yeah.
So it's kind of just that disconnection when it comes to it. So say a child's been diagnosed with autism. What's the next step? What do you do? How do you help it? How do you help them be more comfortable and progress?
Well, that's a large order.
Is that a large order?
Yes, I know. I'll break it down.
Yeah, break it down for me.
The first part is diagnosis.
Okay.
We really want to get into making a diagnosis. And some cases are obvious. Kind of, you have the child walk in the room, you already know what you're looking at.
Right.
Because they are different. But others can be very subtle. Those are what are called the Asperger's syndrome. They're very smart, but they have this shyness where they understand language a little differently. But then once you've achieved the diagnosis, the bigger part that I find is, it's a shock to both parents and the doctor, believe me, because that's one of the diagnoses doctors don't like to make.
I'm sure.
Yeah, because you're seeing a beautiful child and suddenly somebody's saying he may not do as well. Right? He's not what you had aims for, kind of stuff.
Right.
But so once they get beyond the shock and they get it ready to treat, then first of all, we want to make sure that there is no other condition that looks like autism that we're missing. And the commonest, of course, is hearing loss.
Oh.
People who don't hear don't speak.
Well, right.
And if they are not
okay.
hearing right, they are not speaking right.
Okay.
Right? So also, if they have had, say, a tumultuous pregnancy or delivery, they may have prematurity, they may have other illnesses. Sometimes they have chromosomal disorders. So autism, when you look at it from a doctor's viewpoint, it's kind of a basket term. You know what that means? It means so many things can come in that basket. It's not an individual condition.
Yeah.
Just like hypertension can be caused by so many things. So also autism, it can be because you have a chromosomal disorder. It can be because she had a premature baby that got brain damage because of multiple conditions. Or there are metabolic disorders that damage the brain. And some of it could be, that's the bigger controversial one, is environmental.
Right.
So we like to think one part is genetic, one part is environment.
Right.
And that debate has been going on for a lot of time. Then there was this big fear which somebody sparked off in the paper many years ago, where they said immunizations can precipitate autism, and that has not left us.
Right, I'm sure. Everyone's got all the questions, and they Google and the doing it themselves. It's always better to talk to a pediatrician. It's always better to make an appointment with Slocum Dickson. Right. And first of all, thank you so much for coming in and teaching us and making us learn a couple things about it, because not everybody knows as much as they probably should. And Slocum Dickson Medical Group, SDMG.com, Facebook, and Twitter. Thank you guys so much for coming in this morning, and I will see you next month.